So what are the foods that make it worse? Well, sometimes, like with gout, we already addressed a few things, but celiac disease, gluten. If somebody has celiac disease, gluten, just even a little bit of gluten or wheat can cause a lot of problems. Now, some people may not have celiac disease, but they're gluten intolerant. Not everyone is, but some people are. And so they consume wheat or gluten and they notice that they get a flare up. So then they need to avoid that. But not everybody will have that problem when they have arthritis. Gout, typically alcohol and animal flesh, as we said, any animal flesh, not just seafood. I always laugh when I think of seafood. I have a patient who has gout and he tells me he's on a seafood diet. And I'm like, oh my gosh, no, that's the last thing you want to take. Please tell me you're not having a seafood diet. He's like, no, no, no. I see and I eat. Seafood diet. I know I can't see you, hear you, Joe, laugh, but I hope this made you laugh a little bit. So anyways, high fructose syrup, and it's almost embedded in a lot of processed foods and salad dressings and processed foods. So be mindful, and drinks. Be mindful that high fructose syrup can be also a trigger for gout attacks. With people who have inflammatory disease, especially rheumatoid, oils rich in omega-6 and saturated fat and trans fat can actually lead to a flare-up. Dairy has been seen to cause flare-ups of inflammation as well, especially in rheumatoid and certain autoimmune disease, psoriasis, even of the skin. And animal protein can also be a trigger for inflammation. Some people may notice that they have triggers to certain foods. So I get a lot of questions about what about nightshades or tomatoes or stuff like that. Not everybody has to avoid those, just like not everybody has to avoid peanuts, because not everybody's allergic to peanuts. So if you find that there's a food you can't have because you consume it, even if it's a health food, you consume it, you flare up, I'd say avoid it. And then you can retry down the line months later when your inflammation is settled or better controlled. So there are other things that they won't affect everyone, but can actually be triggers for some people. And some people may need to do an elimination diet where they come off everything and they introduce one food at a time, maybe just brown rice first, maybe a few zucchinis, and then slowly introduce other things and make note of what has caused them to flare up.